Hey guys, welcome back to my channel. I'm Antonio Robinson, and I am a nationally registered EMT. Now, all the time, whether it was from my parents when they first found out I got this job, to my family, to my friends, they say, "How's life as a paramedic?" And I always gotta smile back and say, well, I can't tell you, I'm not a paramedic, I'm an EMT. So in this video, I'm going to explain the differences between EMTs, paramedics, and overall the different levels of EMS so you guys can get a better scope and better understanding of what the EMT does versus a paramedic, versus what the other types of EMTs can do. Now, in general to this story, keep things simple. There's 5 different levels of EMS, which is Emergency Medical Services. In this video, I'm going to be telling you the training required for each type of job, the scope of practice and what they can do, and how much they make in each specialty, or in each level of EMS. To start out, the easiest emergency medical services job to get into is an EMR, which means an emergency medical responder. An emergency medical responder takes around 4 to 8 weeks of class time, so not too bad. You have to take a national exam as well. But in some states it varies from state to state, but some states require a couple other certifications. But EMRs really provide like immediate life-saving skills and very basic skills until EMTs or paramedics can arrive. They could do CPR and first aid. When it comes to CPR, they have a basic BLS certification. They could do CPR and they could apply to AED, which is an automatic external defibrillator, which will try to restart the heart. They can control some bleeding, and they can bandage up wounds, and they can splint up minor fractures. Of course, it varies from state to state and individual EMS agency to agency, but in some places, EMRs can also take vitals, but they can't actually ride in the back of the ambulance on a call. Oftentimes, people like police officers and some firefighters will take a class to become an emergency medical responder just so they have a little bit of medical knowledge just in case they're in a situation where they need an ambulance, but the ambulance might be like 10-15 minutes out, so they could at least start on something and get the ambulance crew some information when they get there, since it's an easy barrier to entry and it only takes around 4 to 8 weeks. Now, with that being said, if you work in an emergency medical services job in particular, and you're just an EMR, in my state, mind you, this changes from state to state, location to location, and company to company, but in my state, I found that the average EMR makes around $14 an hour. An EMR also, at least in my area, EMRs can be with you, but they cannot actually take any calls, which means they cannot take any calls themselves. So they cannot be the only person riding in the back of the ambulance. There has to be at least an EMT basic or above riding in the back of the ambulance with the patient. It cannot be just an emergency medical responder. Most of the times, emergency medical responders can help out on scene with their scope of practice, and usually they just end up driving the ambulance. Especially in my state, they are not allowed to be in the back by themselves. That was level 1 as EMR. Next up is level 2, which is an EMT basic. I myself, personally, am an EMT basic. I would recommend that anyone that wants to actually get a career in emergency medical services starts out as an EMT basic. I say that it's better to just skip over an EMR and just go straight to an EMT basic. You could do a lot more. There's a lot more job opportunities. And it's around a 3 to 6 month course. You have to pass a national exam. You have to get your state license. And from state to state, there's other requirements such as a certain amount of skills trainings, certain amount of time spent on an ambulance, and just some other variation from state to state, but in general, it should take you around 3 to 6 months. But as an EMT basic, you do have a significantly larger scope of practice than an EMR. As an EMT basic, you can do everything I listed as an EMR, but you can also do patient assessments, teach you to take vitals, patient history. From those vitals and patient history, you should be able to get an idea of what is going on with this patient or the body system that's causing this, and be able to report that to the hospital or paramedics or other crews coming along. As an EMT basic, we could use basic airway adjuncts, which are basically this patient is unconscious or they can't control their own airway, like, so say they're unconscious and their tongue falls back where it blocks them from breathing air. You could insert an OPA, or in some states, not in my state, but in some states you could do an iGel, or you could do an NPA, which basically sticks a tube up their nose and just allows them, all of these just allow them to have access to their airway still, even if they're unconscious. We are able to provide oxygen to patients that need oxygen through a variety of different devices, from a nasal cannula to a CPAP, nasal cannula to CPAP to a bag valve mask, which are like the masks that fall from the plant that you put over your nose. We're able to control bleeding. We're able to do splint fractures and splint injuries. We are able to do spinal immobilization, from putting on a C-spine collar to putting them on a backboard to other immobilization techniques. We can assist with certain prescribed medications, such as an EpiPen for allergic reactions, nitroglycerin, aspirin, albuterol, and oral glucose. And it vary from state to state. Some states you could give a little bit more than that. Some states you could give a little less than that. And yeah, interestingly enough, in our scope of practice, we can also deliver a baby. Of course, if there is a paramedic on scene, or a nurse or a doctor, or anyone that has a higher scope of practice, it would be greatly appreciated on scene. But it is in our scope of practice to assist with delivering the baby, check the baby's condition when the baby comes out the womb. You can give that in the report to the hospital. EMTs are probably the most common level of certification in EMS. I feel like most of EMS is made up of EMTs. From a lot of times you'll have firefighters that are EMTs. Most firefighters are EMTs. A lot of volunteer firefighters are EMTs. And just since you could do a lot of stuff, and it has the lowest barrier to entry from cost and time commitment, a lot of people do end up becoming an EMT. EMTs make around, in my area, around $17 an hour. So yeah, as you can see, a little bit more than an EMR, but still not what you would expect for an EMT. But yeah, we're going to go on to our next level of certification, which is an advanced EMT. Again, it takes a little bit longer, but you have a higher scope of practice. In my state, it takes around 3 to 9 months, and a certain amount of skills testing. You have to do clinical hours on an ambulance, and you have to pass a national exam. But yeah, should take around 3 to 9 months. Now, advanced EMTs can really do everything that an EMT basic could do, but where they can, they also can give a few more medications than a basic EMT. They also can, they have a couple more airway devices that they could use for if a patient's unconscious. But I think where an advanced EMT has the coolest scope of practice addition, and where they can make an even bigger impact compared to a normal EMT basic, is they can start IVs, which are pretty essential in EMS. They can start IVs, and they can do IOs if necessary. An IO, I don't think you ever want to have an IO, but it's basically where they can't access your blood. They can't access your veins for an IV. You desperately need some sort of medication or something. So they will literally, it's a drill, and it will drill into your bone. You usually don't feel it in that moment, but you will feel it later, to say the least. But yeah, those are the coolest scope of practice additions for an EMT advanced. In my area, they make around $21 an hour, so that's that. Keep that in mind. But yeah, they're like an intermediate step between the EMT basic and a paramedic. It would be the EMT advanced. Now here's the big one, and probably the reason you're watching this video. The paramedic. It takes around 1 to 2 years to become a paramedic. Along with that, you have to pass the national exam, you have to pass your skills testing, you have to do a certain amount of clinical hours on an ambulance, vary from state to state. You have to do a certain amount of clinical hours in the emergency room too. So yeah, you're going to see it all, you're going to do it all. You want to make sure you know what you're doing when you go out there. When it comes to the paramedic, it's almost right at the highest level of pre-hospital care in EMS. You can do everything that EMT could do, and an advanced EMT can do. Do even more advanced airway maneuvers, such as intubation, which is where they basically put a tube down your throat. If you're unconscious, like example is a cardiac arrest, they usually intubate the patient, make sure they can breathe adequately. But they can do those advanced airway procedures. They can also do cardiac monitoring, so from a 4 lead to a 12 lead, which literally basically lets them take a picture of your heart and be able to figure out is this person on the verge of having a heart attack, if they're an AFib, VFib, just a bunch of different cardiac things they can see under the monitor and interpret. I've been saying AED and automated defibrillation a lot in this video in the case of a cardiac arrest, but a paramedic can look at the monitor and look at what the patient's presenting as, and they can do manual defibrillation, where rather than just like an automatic current is sent through the patient in a cardiac arrest, the paramedic would be like, we're going to give him this much volts of defibrillation in a cardiac arrest based on what they're presenting on the monitor, which is pretty interesting and pretty cool. Again, they cannot officially diagnose or perform surgery or anything, but they can do that cardiac monitoring, that the advanced airway procedures, the cardiac monitoring, and also, I think the coolest addition in their scope practice is they can administer a lot of medications, including narcotics. There's so many medications I can't even list them all, but a paramedic is around one of the only other people in the healthcare industry that can actually administer medications besides, doctors and physician assistants. Of course, they can prescribe and administer medication. You would think that maybe a nurse could be like, oh, this patient needs this medication, and just give it to them, but not even a nurse could do that. They need a doctor's orders in order to actually give out medication, but a paramedic could be on scene and say, this patient needs this medication, and I'm going to give it to them, which is a pretty interesting scope of practice for a paramedic. Along with the advanced airways, and I was telling you about intubation, you'll actually see that a lot of times in hospitals, a paramedic working, and sometimes these paramedics are better at intubating a patient and sticking that tube in than even the doctor himself are, because the paramedic is so used to doing it and so often compared to a doctor. Now, there's also one more level to this, which is a critical care paramedic. And honestly, the paramedic I just gave you as an overview, there's probably some extra things that they could do that I missed. And to address that one day, I'm going to try to have a paramedic I've met in the field come onto the channel. You guys ask questions and, just have them answer commonly asked questions about a paramedic. Now, there's one more level to this thing, which is the 5th level, the highest level in the highest scope of practice, which is a critical care paramedic. Critical care paramedics basically can provide intensive care unit, ICU level of care to patients in the field, on the ambulance, wherever they're working at. Couldn't find out much online. I probably should talk to a critical care paramedic and find out more. But from what I've found is it's an extra certification they need. I actually don't know how long it takes to get that certification. But with that certification, you might see them you might see a critical care paramedic on those life flights and stuff, working with doctors and nurses. They can administer a few more advanced medications, and overall, they just could provide intensive care level, ICU levels of care for patients in the field. Basically, it's a little bit more than a paramedic can do, which is pretty cool. From what I've heard, this varies a lot from place to place and from person to person, especially the longer you worked at a place. But starting out, I think paramedics make around $26 an hour, and critical care paramedics make around $32 an hour. I hope you guys did learn something from this video. As you can see, there is some pretty significant differences between just a EMT and a paramedic. So again, we all work together. We're all team members. And we love we need each other at the end of the day. But as you can see, paramedics have a lot more education and a lot more scope of practice with that education, and they can do a lot more interventions. But of course, EMT basics, advanced EMTs, EMRs. At the end of the day, we're all here to support the patient, try to provide them the best level of care they need, and get them to the hospital, keep them alive, and help them get recovered. That's about it. At the end of the day, if you want to get into EMS, feel free to leave a comment down below, ask questions. I can try to help you out. That's about it. Until next one, Antonio out.